Kani kadega Batesi TV, bat pidang pet yaki kubor baman kasni, balawan rasha pida ka orange nisan, lom so po niya fabricate Shnong.
Hadin bala pentikena ba uway na kinong Shnong jong ni gejala ulangat hau kenyang jengpang COVID-19. Ubadai u doktor rang ba jong ka Bethany Hospital Shnong. Haka katsau terek mataw banaya yong arajar arpo ka kanhon menteri jong ka Sorkar Meghalaya Democratic Alliance kalasyong jalang kerke banyak keren halor kumno ban syemi kilat kelenti banyak hon nakajing Saphriang yu coronavirus haka ni gejala kamtam haka ni kanomba Shnong.
Friends, we are still going into the investigation of this case, but on the preliminary investigation that is there, the information that is coming to us is that one of the relatives of the concerned person had a travel history to one of the infected countries and was back in Shnong before the 14-day quarantine period was over. And though the person continued to inform 108 and registered himself and took all the precautions, sometimes what they call in medical terms, there are asymptomatic cases also which do not show any symptom, but you could be a carrier. So therefore, there is a high chance that it could have been passed on from there. But of course, these are only preliminary informations that we're getting. We're looking at all the different possibilities on how this could have happened. I sincerely urge the people of the localities, I sincerely urge the Rangba Shnongs and the elders in the society and the religious leaders in the society that this is the time when we must come together. These people who were working in those institutions, it's not their fault. And I don't think as a society our actions should be in any way negative or look in any way as if we're blaming them. We should support them. But that does not mean that we should be careless in our ways. We need to be careful. But we can ensure that we protect ourselves and be careful, and at the same time, as I said, act responsibly and be sensitive to these people who are going through a difficult time. I urge the people of Shnong and the citizens of Meghalaya that this is a time that our true color of our society should come out, which should be a society which understands these situations and works together to resolve the problems that we are facing. We are really having a challenge at this point in time, which I can assure you that our team has been working very hard and is up to the challenge. We are doing many tests. We have quarantined the institution. We have contact traced all the primary and the secondary contacts, and we are in the process of ensuring that more and more tests will take place. All tests cannot take place at the same time. Therefore, we will start with the primary contacts and then go into the secondary contacts. We estimate that there could be around 200 plus primary contacts that are there, and already 50% of them have been sent, the samples have been sent for testing, the results of which should be coming out very soon. The coronavirus, which is the COVID-19 virus, is a flu. And 85% of the people who get this flu are either asymptomatic, which means they show no symptoms, or are people who will have very, very light symptoms like light fever, flu, or a cough and won't even realize it. And most probably after 14 days in most cases, and in some cases after 20 days, 21 days, these symptoms and the flu is gone. So 85% will be facing this kind of a problem. There are only about 10 to 15% cases where you might see individuals who might need some medical attention. You might have 3 to 5% cases which might have require ventilation. But in general, most of the cases, anything between 85 to 95% of the cases are cases which are not critical. Yesterday we had a cabinet meeting where we had taken some decisions in light of the lockdown period that is going to come ahead. And at that time, this particular case was not there in front of us. But in the light of this case that has come in front, where one person is tested positive, the cabinet today met again, and we have decided to go back to the old system that we had started. Therefore, all the decisions that were made by the cabinet yesterday stand nullified as of now. We will not have any intra-district movement. We will not have any inter-district movement. We will not have any social gatherings. We will not have the schools open. At the same time, public as well as private transport will be restricted throughout the state. So therefore, friends, this is being done again in the interest of the people to ensure that we can overcome this situation. At the end, I would like to assure all the citizens of our state that please take care of yourself, and I want to assure you that you need not worry. The government and the health department and the administration is very much in control of the situation. As I said, in the last 18 hours, we have identified more than 2,000 people. We have quarantined and closed the institutions and the branches.